Hi, my name is Robert Mitchell-Thain. I'm the CEO of the PBC Foundation. So it's a pleasure to speak with you today. My story in PBC began some 31 years ago when my mother was diagnosed with the condition. It's just past her 31st anniversary where she was given 5 years to live, which was a shock to everyone. She's still here, still guides, advises, and is very much part of the PBC Foundation itself. I have worked for the PBC's Foundation since 1993, and my personal tagline, if you will, is to try to use the patient experience to improve the patient experience. I think the one thing that I do more than anything else within my role is to listen to patients, take their journey, take their experience, take their knowledge, and the unmet need with which they live every single day, and try and use that to make things better, frankly. PBC, as it stands at the moment, is a rare autoimmune liver condition. The way I describe it is if you can imagine being in the bar, there's a fight that breaks out in the bar, and instead of kicking out the people who are fighting, the security come in and they kick out the bar staff instead. And this is what happens with PBC. Your own body security guard, your immune system, attacks the wrong cells and creates damage within the liver. If everyone with PBC was diagnosed, I'm not sure it would be rare. As rare diseases go, it's quite common. So it's not in the ultra rare field. And historically, we've always talked about PBC affecting more women than men. Now, historically, the numbers have been 9-1, but more and more countries are coming out with 5-1, 6-1, those kind of figures. So we won't really know until we find every single person affected by PBC. But what I can tell you is there are two parts to PBC in terms of developing the condition, and you need two pieces of bad luck. So the first piece of bad luck is your genetic inheritance. So you have a genetic predisposition to the autoimmune conditions. And then your second piece of bad luck is an environmental trigger, which then starts off your immune system. It starts off your security guard on that attack on the wrong cells. Now, people with PBC will often have other autoimmune conditions. So there's a real link between conditions like PBC, like rheumatoid arthritis, Sjogren's syndrome, type 1 diabetes. All of these conditions are all sit in the same family. And so it's not uncommon at all for somebody with PBC to have other family members who will have other autoimmune conditions. When you look at the PBC diagnostic odyssey, if you will, it varies from patient to patient. It varies from clinic to clinic, and it absolutely varies from country to country. We find in the UK that up to 60% of patients are diagnosed asymptomatic. So they have no symptoms in terms of what's going on with their liver, and yet they're diagnosed with PBC. In the UK, we have a really nice flow chart that's part of a guidelines for clinicians and nurses that when they experience a patient with abnormal liver tests, that they follow this flow chart, and that tells you which diseases to look at. So more and more often, we're finding patients who are diagnosed within 2 to 3 days and are signposted to patient support immediately. Now, that's best practice. That's brand new. That's never happened before these last couple of years. And so we are hoping that that becomes experience everywhere. However, the reality is that, as with many, many rare conditions, it's really difficult to get a diagnosis. So the frustrating part is PBC is incredibly easy to diagnose. It's a simple AMA blood test and then a look at abnormal liver biochemistry. But for some people, because of lack of awareness or lack of knowledge, it's actually incredibly difficult to diagnose. And so you have this ease of the tools and the gap in knowledge, which can create an issue for some patients having an early diagnosis. If I may add that one of the key parts to PBC, and this is why it's so incredibly vital, is that if you're diagnosed early enough in your journey and you respond to therapy in the sense that you get normal liver biochemistry, then you can anticipate a normal life expectancy in the main. But if you don't, and you don't, then frankly, you don't. And that's the key message. And this is why it's so incredibly important that as many people with PBC are diagnosed as early as possible and given appropriate treatment as early as possible. So when it comes to PBC treatment, there are two parts to the disease. There is the aspect where we are looking at and trying to prevent disease progression. And we can talk about that in a second. And the other part to PBC is looking at what we call either the symptom burden or put very simply, quality of life. Most people with PBC will be affected by fatigue and or an itch under the skin. Now, when we talk about the fatigue, it's not tiredness. People with PBC will often struggle to dry their hair because the idea of keeping their arms up like this in this moment is really, really difficult. People with PBC often don't hang up their clothes. They'll hang up their clothes to dry hair. And so there is a weariness in the body. So it's very, very accurately described as walking through custard, the sensation of wearing a lead blanket, or even just having the power pulled. So it's not a tiredness, and it's not a tiredness that can be helped by sleep. And the other main symptom is an itch under the skin. Now, for some patients, this can be a threat to life, either through suicide or through a potential liver transplant because no other medication is working. So that's the symptom part. And then the other part is to look at disease progression. Disease progression in PBC is something that's incredibly important because it has implications for life expectancy. There are a number of medications available, and this would very much depend on which country you are in. So, for example, in the UK, we have ursodeoxycholic licensed as the first line therapy, and that's fairly global. Then you have obeticholic acid, which is a licensed second line therapy, and that's available in some countries, but not in others. For example, in the EU. Then you have a new compound called elafibranor, which is also licensed and authorized in the UK. And again, that's available in some countries. We also have a treatment which is off license, but it's often used called bezafibrate. Now, bezafibrate is not available in the US. In the US, you have ursodeoxycholic acid, obeticholic acid, and then you've got elafibranor and another compound called seladelpar. So you have a whole range of different compounds that are available for disease treatment, and it very much depends on where you live as to what's available to you. Is there a recommended treatment? In terms of first-line therapy, ursodeoxycholic acid is in all the guidelines, and every patient should be offered that in the first instance. Thereafter, it comes down to knowledge, geography, and the relationship and partnership between the patient and the clinician. So here in 2025, we are in an incredibly exciting time for PBC. We've made enormous progress when it comes to disease progression and the treatments and the options. And so now we're left with the final frontier. Now, we at the PBC Foundation, we've produced abstracts, we've produced posters, and we have released what are known as patient-recorded experience measures and patient-recorded outcome measures. So we use our data to produce aggregated, anonymized data on how the PBC experiences their life living with this condition every single day. And what's interesting when it comes to itch, because we go to the conventions and we're told that this drug works or that drug works, or this drug really makes things worse, or this drug's the greatest thing since sliced bread, where actually the patient-reported data tells us that none of it makes a blind bit of difference. So when you look at some of the data we produced, your age has no impact on how much itch you have in your life. The length of time you're diagnosed, your sex, your treatment. So if you're on first-line therapy, if you're on second-line therapies, which second-line therapies, if you've responded, if you've not responded, all of these don't seem to have an impact on who experiences itch and who doesn't. So when you speak to a PBC patient with itch, they will tell you in very, very direct terms that what's available at the moment is not working. PBC is a rare condition, and as such, you live life often on the fringes. You're on the fringes of science, you're on the fringes of budgets, you're on the fringes of public awareness, and you're on the fringes of treatments. Now, I was recently at the EASL International Liver Congress in Amsterdam, and I was there when our Professor Gideon Hirschfield from Toronto, Canada, presented data on Linerixibat. And we can talk about that data in a second. But what is really important was this was a room with hundreds and hundreds and hundreds of clinicians, scientists, academics, patient advocates from all around the globe in one room at one time to listen to data, acknowledge the science, and realize that more not only can be done, but absolutely needs to be done to help patients that are affected by itch and PBC. Wherever you are in the world, you may or may not be aware, but there was recently key data that was shown with regard to Linerixibat. Linerixibat is an IBAT inhibitor, which in really simple terms flushes out some of the compounds that are associated with itch in PBC patients. It's not the only one of those that's available in terms of the research and the data that's going on, but it's the first one in the process in terms of timelines. So it's opening up these conversations. So first of all, I want to acknowledge that there are more than one IBAT inhibitor, but I also want to acknowledge that this is an incredibly important development for PBC patients. These compounds work in a way that's never been used before, it's never been licensed before, and it's never been released to patients generally before. But what we find that patients who speak to us about it is that it's an incredibly positive experience. When patients talk about their itch, they talk about spiders or ants crawling under the skin, not one or two. Thousands of spiders in the eyes, your underarm, under your fingernails, in your bikini bits. It's not pleasant, and it has an incredible effect psychologically, emotionally, and physically. You'll often see people with PBC wearing long clothes in the summer because they're embarrassed. They've scratched and scratched and scratched and they've torn their arms open. You will see patients with PBC who have the itch, who are absolutely physically, emotionally, psychologically exhausted. What they would do for one night's sleep. So this is why Linerixibat and all the other IBAT inhibitors that are coming along is so incredibly vital, because the potential there to change a PBC patient's life forever is absolutely in our hands right now. 2024 into 2025 and beyond, we in the PBC community are very much focused on Project 9090. In really simple terms, Project 9090 is a campaign where we're asking for 90% of PBC patients to have access to 90% of the care standards in the guidelines. Now, this is really simple stuff. Are you on the right therapy? Are you on the right dose of therapy? Have you been measured to be responding to your therapy? If not, can we put you on a different therapy? Let's look at your symptoms. Do you itch? Are you fatigued? Can we help you with those? If your disease has progressed further on, are we doing the right monitoring? Are we looking at your bone density? Are we looking at your comorbidities? And if you don't know what comorbidities are, they're just the other bits that come with living with an autoimmune condition. This is all we're asking. It's really, really simple. Now, what we found out is that the 12 pilot hospitals in the UK thought, you know what, let's have a look at this. So they used a formal document called an NHS Care Bundle, and it has those 10 questions. And remarkably, if you ask those 10 questions, 90% of patients will access 90% of the care standards and guidelines. It's really simple, it's really easy, and we're absolutely supporting you in your journey as a patient, as a scientist, as a clinician, to ensure that every patient gets the care they need.